Paricalcitol, also known as Zemplar, is used to manage high levels of parathyroid hormone in patients with long-term kidney disease. This hormone imbalance is caused by low levels of calcium and a specific type of vitamin D. Too much parathyroid hormone can lead to serious bone disorders, so paricalcitol, a synthetic form of vitamin D, helps to lower parathyroid hormone levels and improve the body's absorption of calcium and phosphorus. When taking Zemplar, follow your doctor's instructions on whether to take it with or without food. Your doctor will usually recommend taking it once a day or 3 times a week. If it's 3 times a week, don't take it more often than every other day. Your dosage will depend on your medical condition, lab tests, and how you respond to the treatment. Take the medication regularly to get the most benefit from it. Try to take it at the same time each day, and if you're taking it on a schedule other than every day, like 3 times a week, mark your calendar to remind yourself. Following a diet recommended by your doctor is very important to get the most benefit from this medication and to prevent serious side effects. Only take other supplements or vitamins, like calcium or vitamin D, if your doctor tells you to. It's important to remember that your doctor prescribed this medication because they believe the benefits outweigh the potential risks. Many people taking this medication do not experience serious side effects. However, if you experience any serious side effects, it's important to inform your doctor right away. This includes symptoms such as changes in heartbeat, seizures, weakness, loss of appetite, pain in the back, bones, joints, or muscles, constipation, dry mouth, eye pain, redness, or sensitivity to light, headaches, nausea, vomiting, drowsiness, stomach or abdominal pain, increased thirst, changes in urine output, or mental/mood changes. While rare, a serious allergic reaction to this drug is possible. If you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And if you're in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Zemplar, make sure to inform your doctor or pharmacist about any allergies you may have, especially to vitamin D products. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history, including any high levels of calcium or vitamin D, heart disease, or seizures, with your doctor or pharmacist before using Zemplar. If you are pregnant or breastfeeding, talk to your doctor about the risks and benefits of using this medication. And if you have surgery planned, be sure to inform your doctor or dentist about all the medications and products you use. Drug interactions can affect how your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medications without your doctor's approval. Some products that may interact with Zemplar include burosumab, other vitamin D products, and products that contain aluminum. Check the labels on all your prescription and non-prescription products because they may contain ingredients that interact with Zemplar. Certain medications can also decrease the absorption of vitamin D, so it's important to separate your doses and talk to your doctor or pharmacist about finding a dosing schedule that works for all your medications. Zemplar may also interfere with certain lab tests, so make sure your lab personnel and doctors are aware that you are taking this medication. If someone takes too much Zemplar and has serious symptoms like passing out or trouble breathing, they should call 911. Otherwise, they should call a poison control center right away. In the US, residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include weakness, headache, loss of appetite, nausea, vomiting, stomach cramps, and drowsiness. It's important not to share Zemplar with others. While taking this medication, it's necessary to have regular lab and medical tests to check levels of calcium, phosphorus, and parathyroid hormone. Make sure to attend all medical and lab appointments and consult your doctor for more information. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the one you missed and take your next dose at the usual time. Don't take 2 doses at once to make up for the missed one. It's important to store Zemplar at room temperature and away from light and moisture. Avoid keeping it in the bathroom, and be sure to keep all medications out of reach of children and pets. When it comes to getting rid of any leftover Zemplar, don't flush it down the toilet or pour it down the drain unless advised. Instead, be sure to properly discard it when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.